I'm checking my orders. I'm gonna insert a nasogastric tube to low intermittent suction and check the pH and flush with tap water every 4 hours. Her name is Abigail. Her date of birth is 2/5/1952, and she's allergic to sulfa. She has a bowel obstruction. Okay, now I can go in. Knock, knock, knock. Hello, Abigail. My name is Hailey. I'll be your student nurse today. Fix your head. I'm going to be doing a NG tube insertion on you today, and I just came in to do that. I'll check and make sure everything's safe and provide privacy. All right, Abby, we're going to go ahead and,
You're fine.
Can you tell me your name and date of birth, please? Abigail, 1952, 25. Yep. And are you allergic to anything? Sulfa? Yep. Okay. All right, I'm going to go ahead and raise you up to a working height, and then I'll get your head raised too in just a minute. So that we can start the procedure. Okay, first thing I'm going to do is I'm going to ask you some questions. Have you had any nasal or esophageal surgeries? No? Okay. Have you ever had a gastric bypass surgery? No. Do you have any bleeding issues, or are you on blood thinners? No? Okay. I'm just going to go ahead quick and check your, I don't know if this is the time to do it, but I will. Nasal, no occlusions, nothing in the back of the throat, good. And now I'm going to prep some tape and your tube. Okay, get the tube out. Make sure it is clamped. Okay, we're going to measure this now from the tip of your nose to your earlobe down to the mid-umbiculus. It is at 60 centimeters, so I'm going to go ahead and tape that so I know where to stop. And then we can just put that back. And then the doctor's orders are low intermittent suction, so I'll turn on your suction. I'll turn it to low.
What color is low?
Low is green, intermediate is yellow, and high would be red or orange, but we're on green. Everything is prepped for that. The suction is going. Okay, Abigail, I'm gonna go ahead and get you ready with a towel, whatever you want to call it, an emesis basin. This is for if you get sick. And then I'm going to take your arms out so we can make sure. All right. This water is going to be for when I insert it. I'll have you take sips and I'll tell you when. And then I'm going to go ahead and put your pulse ox on so I can check that throughout. And then I think we're ready. So I'm going to go ahead and lower this first. Do some hand sanitizer and put my gloves on. At least you don't have to be perfect, right?
Put it that way. My stomach's growling. You're gonna hear that in the video.
These gloves are kind of whack. Okay.
Distress signal.
Okay. Abby, this should not. Oh, and I forgot to do one. I'm gonna text your gag reflex. You have one. Good. Can you breathe out of this one? Can you breathe out of this one? Yes. Okay. And then this should be a little uncomfortable, but I will not force it. If at any time you feel like it's just too much, please raise your right hand and I will stop. Put some lubrication on. All right, Abby, I'm gonna have you tilt your head back towards the back of your chair, bed, pillow. And then we're gonna push this in, down towards your mouth. Alright, I met some resistance. Now I want you to tuck your chin for me. And take sips of water, take sips of water. I'm checking your pulse ox. Take sips of water. Checking your pulse ox. Take sips of water. I'm checking your pulse ox. And one more time. Take sips of water. I think it got stuck.
Good enough.
Yep. Okay. Just gonna quickly tape this here so that it doesn't come back out on your eyeball. Sounds good.
Yes.
Okay, now we're gonna test your pH just to make sure it's in the right spot. Yep. Pull out. I took some out, just won't go. Put back in. Alright, and the pH is below a 5. It's at a 4 right now. Perfect. Throw that away. Set these guys back down. And we'll get you hooked up to suction now. Okay. And some yellowish brown secretions are coming out. That's good. We're going to tape it in place just so it doesn't fall out. Or band-aid it in place.
To check if it's coiled in the back of the throat.
It's not coiled. Good. Okay, and things are looking good. You did good. Now go ahead and hook you. Take away all this.
Safety pin.
I'm gonna have you turn your head, and then we'll give you some slack. And our safety pin it right here. Have some slack. Okay, and now we're just gonna do some oral cares and some nasal cares, and then you are good to go. All right, Abby, your call light is over there. If you need anything, you can call me. I will be back within 30 minutes or so to check on you. Otherwise, every 4 hours, and as needed to flush and check the pH. If you need anything, just let me know, and now I'm gonna go document. I'm gonna document that I inserted in Salem sump 14 French, 60 centimeters. The pH, on low, intermediate suction, pH was a 4. Patient tolerated well, and
You had some secretions.
Yeah.
It's in the right nair.
yellowish brown secretions. It's in the right nair, and she has her call light within reach, and I'll be back.
Perfect.